More than 600,000 seniors, that's above people above 60 years of age, have already signed up so far for Healthier SG. Well, that is the national strategy focusing on preventive healthcare. It's now expanding to include the next phase as people aged 40 to 59. Earlier this month, Health Minister Ong Ye Kung said SMS invites are already going out to this group. For a further update, we speak next to two experts. Associate Professor Lian Leng, he's Director of Population Health and Integrated Care Office at SGH, and he's also Director, Centre for Population Health Research and Implementation, SingHealth. And of course, Dr S Suraj Kumar, Vice President of the College of Family Physicians, Singapore. Welcome, gentlemen. Thank you for coming.
Good evening.
Thank you, Wei Su.
All right. We'll start with you, Prof. Loh. 600,000 or more than 600,000, and for GPs, I'll qualify that eligible GPs, more than 90% coming on board, according to some sources. How do you rate progress, Prof. Loh?
Yeah, well, I think we are off to a very good start for Healthier SG. As you rightly mentioned, more than 600,000 have enrolled in Healthier SG. And this is really the first step to building a very strong primary and community care system as a foundation of our healthcare system and Healthier SG approach. However, Healthier SG is really a multi-year journey that requires all of us to play a role. So not just primary care hospitals, but also ourselves as patients to adhere to the health plan, to go for regular health screenings, and also to adopt a healthier lifestyle. So,
yes, I agree. Everything is positive, but just as in the implementation of any new system, there will always be challenges faced by the people involved, the doctors, the clinic staff, and the patients themselves. But with the support from the Ministry of the Health, as well as professional bodies like the College of Family Physicians, I think now the process is much smoother. It takes time to get used to a system, but as we move forward, I think we should be positive about the outlook.
Yeah. All right, Prof. Loh, I'll get back to your point, but I'll pick you up there. I notice you're being fairly positive about it, but I'm sure like any new initiative, there will be some resistance, some fear as well. So for GPs, there will be some cost. So increased administration, possible loss of revenue. Are these real concerns in terms of your managing this particular sector?
Yes, there are concerns, but there are factors that are going to mitigating these. For example, administrative costs is inevitable when you have a new system, especially something as very big as HSG. There's increased administrative work, scheduling appointments, data entry, new IT systems, and also training.
So grants and subsidies is not enough to offset those concerns?
They do help quite a bit, and the ministry has done whatever it can to mitigate these factors. IT grants is one of them. There's also delivery of medicines to patients, and the care fees that are being paid to doctors to look after the HSG patients. So these will help.
And to support GPs and Healthier SG, for example, SGH and SingHealth, we have created Healthier SG teams embedded within the community. So each Healthier SG team comprises of community nurses, well-being coordinators, and partnering with our social service agencies to support our GPs in this endeavor. So for example, in terms of chronic disease management, health coaching, and also the availability of exercise and social activities for doctors to prescribe their patients to.
Working in the areas where you work, Prof. Loh, you can get all the formal support you could want, but if you yourself are not prepared to embark on, this is a change in how we think about how we manage our health, how we manage our lives, how we intend to engage with our GPs. If we are not prepared to do that, all these initiatives will come to naught.
Yeah, so Healthier SG really requires a mindset change in each and every one of us to adopt a healthier lifestyle, to adhere to the health plan that is prescribed by the family doctor, which is why we need well-trained family doctors. We need to build a long-term doctor-patient relationship, and that's only when patients will trust their family doctors to make the right decisions for them and embark on their preventive health journey.
We can't take that trust for granted, can we?
Essentially, it's a partnership between doctors and patients. And so trust has to be built up. So what happens is the doctors, once they're given the mandate by the patient choosing them, he is entrusted with their care, and the doctors will embark on looking after the whole patient, in other words, holistic care. But this also requires doctors to be trained and upskilling of their skills, maintaining of their upskills. And this is where the College of Family Physicians has a major role to play. And one of our primary functions is the training of doctors in family medicine, right, through our programs and our continuing medical education activities. So generally, when you train doctors and they deliver holistic care, then your whole healthcare standards rise. And that's the purpose.
I should also point out that now we are enrolling 40 to 59 years old. And in this age segment, we expect patients to be more technologically savvy. And technology could be potentially a game changer. So for example, the use of Health Hub or Healthy 365 can deliver nudges for behavioral change and also for people to activate a healthier lifestyle.
The minister was saying, don't fear tech in medicine, right? The other part of preventive care and then community care as well. So shifting, so Age Well SG, that's the other part, I think rolled out this year as well, to, I suppose, minimize the pressure on institutions. And everyone knows no senior citizen does well in an institution if they can age well at home.
Exactly.
How does community care contribute to this overall larger scheme that both of you are looking at?
It plays a critical role because there are many factors affecting a person's health and well-being. So not just healthcare alone, but social factors like your family and community support, whether you have social activities that you can go to have a better quality of life. So social activities that are organized by grassroots organizations, people's association are really important to improve that social compact. So we also have active aging centers, which is a key cornerstone of Age Well SG, which then serves as community nodes for various health and social programs for seniors to attend to.
Okay, I think that the principal word there is compact. And let's go back to a final question for both of you gentlemen, starting with Dr. Kumar. Compact between society, government, GPs. Looking forward, what would you like to tell anyone who wonders how to build on that compact? Start with you.
Well, as I stressed, it's actually a partnership. Now you have several stakeholders and a lot of cooperation is needed as we move forward. And when we cooperate, the outcomes will be good. We will overcome the challenges that are being placed in front of us. But as we move forward, I'm pretty positive, confident of the outcome.
Prof, final word from you.
Yeah. So for Healthier SG, it's really a multi-year journey. So everyone plays a role. So I encourage every one of us to adopt a healthier lifestyle, adhere to the health plan, and go for our regular health screenings.
Thanks very much, gentlemen.
Thank you,
Professor Lian Leng, Director, Population Health and Integrated Care Office at SGH, and also Director, Center for Population Health Research and Implementation, SingHealth, and Vice President of the College of Family Physicians, Dr. S. Suraj Kumar. Thanks so much.
Thank you for having us.